Hello, my name is Allison Piazza, and I'm a clinical medical librarian at the Samuel J. Wood Library. In this video, I'll talk about some of the different types of reviews that fall under the evidence synthesis umbrella. By the end of this video, you'll learn how to distinguish between the different review types and choose an appropriate review type for your project. Evidence synthesis refers to the broad category of literature that draws conclusions from published or existing studies. While all these review types are considered evidence synthesis, their methodologies are different. The aim of your project will dictate which type of review you choose. Systematic reviews are a cornerstone of evidence-based medicine. Systematic reviews attempt to collate all empirical evidence that fits pre-specified eligibility criteria to answer a specific research question. They also contain an explicit reproducible methodology. This methodology utilizes several searches that attempts to identify all studies that meet the eligibility criteria. It also involves an assessment of the validity of the findings of the included studies. The overall aim of a systematic review is to produce a statement to guide clinical decision-making. It is hypothesis-driven and fits into the PICO, Patient Intervention Comparison Outcome format. Systematic reviews can be done with quantitative methods such as statistical pooling across the included studies with a meta-analysis. Scoping reviews are not a quote-unquote less good systematic review. They are a different study type with a different aim. Scoping reviews provide an overview of the available research evidence without producing a summary answer to guide clinical decision-making. Rather, they aim to map the body of literature on a given topic and potentially reveal gaps in available knowledge. Scoping reviews share a number of the same processes as systematic reviews, as they both use rigorous and transparent methods to comprehensively identify and analyze all the relevant literature pertaining to a research question. However, it does not involve a critical appraisal of included studies and might not fit into the PICO format. The PCC format, Population Concept Context, may be useful. Finally, a scoping review is often qualitative, so there's no meta-analysis. It's important to remember that not all research questions require or are appropriate for a systematic or scoping review. Some examples are when the question is too broad for a comprehensive, methodologically rigorous review to take place, when there is not enough literature yet available, when there is not enough time to perform this type of review, or when there is not a large enough team available. Narrative reviews are general discussions of a topic and are often invited papers written by experts in the field. Narrative reviews, sometimes called topic or literature reviews, often have no stated hypothesis. Despite this, they can provide rationales for future research and speculate on new types of interventions available. Narrative reviews use a topical approach rather than a question and often take the form of a discussion. The author seeks to demonstrate their understanding and perhaps also present their work in the context of published literature. There is no stated methodology, and there is a potential for bias. If you have any questions about the content of this video, please consult the readings and resources in this module or ask your librarian. Thank you.